Just to give a little bit of a background, it's a little bit of a rehash from some of the stuff we just talked about. We started Brain Turns in 2020, at kind of the peak of COVID. And we had originally had a Brain Turns program, but it was an in-person kind of shadowing experience. And when COVID hit and everything shut down, we opened it up and we brought in, basically, we made it virtual, we made it free, we made it online. And we were able to gather about 16,000 students around the world from over 80 countries. And we looked at the data from this. We looked at who participated, and it was 84% women, which is interesting given the stats we just heard from Dr. Rosen. And on our own field in neurosurgery, we have about 14% women, right, in practicing neurosurgery. And cardiology, I forget what Dr. Rosen said, but similar, right?
Similar,
to
yeah.
the same. And so we said, this is a powerful medium, and not just women in medicine. I mean, this also extended to our inclusion of underrepresented kind of populations in medicine, right? Our Asian population was about 40%. Our Spanish population was about 15%. Our African American Black population was about 7-8%. All those numbers a lot higher than what we see represented in actual medicine participating in this webinar series. And we realized that there's an interest here, and there's obviously, which we all know, a lack of opportunity, a lack of resources to get involved. And so we wanted to make sure we were reaching into medicine and finding people who were like these people, who had interesting journeys, who got through it though, who went through the struggle and they made it to where they needed to be. And so, you obviously jumped into mind as someone who has, followed your passions and also took an interesting route through medicine, right? And ended up where you ended up now. And, this on the kind of, as we still continue to struggle through COVID, really wanted to hear your journey, and especially in light of this last year, kind of how you view medicine and your career, how it's become, and kind of, use it as an inspiring talk to the next generation. So thanks so much for being here.
Thanks for having me. And it's really nice to meet everybody who's listening. I wish I could see everybody, but it's such a great idea. And, I have to say, if there's one thing that I would want everyone to leave with today, it's exactly what you said, Randy, which is really to never give up on your dream and whatever your passion is. And I think we talk a lot about burnout in medicine. And I think the one thing that keeps many of us from burning out is the fact that we have crafted careers that fulfill what we love. And so I do feel very lucky to be here today, being able to both practice cardiology and see patients, which I absolutely love, and also getting to work as a journalist in the world of media, which I love. So it helps keep me sane. But I can kind of back up a little bit just to give you guys a sense of my background. I grew up in a medical household. My father is a cardiologist. My mom was a nurse. And so I really grew up going to work with my dad and seeing medicine and science, and just fell in love with it. And so when I was actually in high school, I know many of your students are at that level, I volunteered for a summer in the Department of Cardiac Surgery at the University of Miami, which is where I grew up. And I got to see a heart transplant, and I thought, well, that's it. I'm sold. I'm going to be a cardiothoracic surgeon. And I really just fell in love even more with medicine than I had already been. So I went off to college thinking I was going to do medicine. And, the first part of my journey out of medicine actually happened right after college, which is that I actually studied economics at Stanford, and I minored in biology. And interestingly enough, my father, who's a cardiologist who loves his work, actually said to me, medicine is a really tough field, particularly for a woman, if you want to have a family, particularly in cardiology. So maybe you should think about doing something a little bit easier, like business. So I went and graduated from Stanford and interviewed for all these consulting and investment banking jobs. And they would say to me, why do you want to be a consultant? And I literally had no answer. And I kind of realized, well, this is probably not what I should be doing. And so here I was, graduated with a degree, had no job, had no idea what I wanted to do, and came up with the idea that I wanted to start my own business, because I figured at least if I have my own business, I might like it better than working for someone else. So I actually started a smoothie juice bar, which was my first step outside of medicine. I opened a smoothie juice bar called Sun Juice in Miami, which is where I was from. It's similar to Jamba Juice, if anyone's ever been to Jamba Juice. And I had like 16 employees. I was 21 years old, and I really kind of learned how to run a business by the seat of my pants. But it was great, and it was a great experience. But the thing that it really taught me, and what I'm so thankful for, is that I really did not want to be in business, because as my business was succeeding, I was not happy. And I was living at home, and I would come home and hear my dad talk about his day helping patients, and really felt like all my day was about was how many smoothies did I sell and how much money did I make? And that's just not what drives me. So I remember one day sitting at our dinner table and sort of feeling like an alcoholic who's saying they're alcoholic. I said, I can't do this anymore. I can't run the store. I can't have this be my life. And here my family and I had invested so much time in this business. But it was a real awakening and a real great moment for me, because I felt like finally I'm going to go on the path that I was meant to go on. So I studied for the MCAT while I was running my business, and I applied to like a million medical schools, and thankfully I got into USC. So I went back to California, and pretty quickly, when I started in medical school, I knew that once again I didn't want to follow the traditional path. My dad, just again to kind of go back to my family, had done a lot of research in the field of electrophysiology and cardiology. He's actually very well known as one of the founding fathers of cardiac electrophysiology, and had lectured around the world and was a real academic. And so, he talked to me a lot about that world. And I knew that that wasn't me. That wasn't what I wanted. I didn't want to publish papers. I didn't want to do clinical trials. I didn't want to work on lab medicine. But yet I felt I had something to contribute different from that. And I knew I liked teaching. I knew I liked writing and communicating. So probably in my first year of medical school, I remember saying to my friends, I want to do what Sanjay Gupta does. And he was really the only person at that time that was kind of a doctor on television talking about science. And my friends at the time thought I was crazy. And they said, well, how are you going to do that? There's no road to doing that. And I just said, I don't know how I'm going to do it. I know I want to do that. And I know there's a value for being able to communicate science effectively and at a level that is not talking above people and is not talking and dumbing things down. So I kind of kept that like thought in my mind every step along the way. So, I loved being in medical school, and I was so glad that I had taken time to do something different, because it meant that by the time I went to medical school, I knew I wanted to be there. Med school is really hard, and I studied a ton and I worked my butt off, but I was so thankful to just have the opportunity to become a doctor. So, as I went through my rotations and trying to figure out what I liked, I kind of always had in the back of my mind the media aspect, but it wasn't really the right time because I was in training. So I went to my residency in Boston at the Brigham and Women's Hospital, and I was an internal medicine resident. And again, the timing wasn't completely right. I remember going to my program director and saying, I have an interest in journalism and media. Can you help me? And he said, I think it's really great that you have this interest, but I don't really know what to tell you to do, because there was nobody who was really doing that. I think they had one graduate from internal medicine in Boston at the Brigham who ended up being a local news reporter. And he said, well, maybe you should, talk to her. So at that point, I had another sort of, every point along your journey, right, you have to make choices. And I had to make a choice previously about medicine or surgery when I was in medical school, and I loved both. And I chose medicine partly because, one, I loved the time with the patients, but two, I knew it would open the door to doing media. And if I was a surgeon, I was in the OR all day, it was going to be really hard. So here I was now in residency, and I had another choice. I knew I wanted to do cardiology. Do I do interventional cardiology, which I again loved the procedural aspect, or do I do non-invasive, which will give me time to pursue the media? And so in a very thoughtful way, I again chose non-invasive cardiology so that I would have time to pursue this other interest. So I finished my training in Boston and I came to New York City, again on purpose. I chose to come to New York because I knew this is the place to pursue this media dream. All of the news outlets are here. And I started my cardiology fellowship at Cornell. And then in my very last year of fellowship, I said, okay, now it's time, right? You've been training forever and it's now or never. So I basically sent my resume and a cover letter to every news organization, every magazine, every television show, basically saying, I'm a cardiology fellow and I'm interested in media, and can I come work for you for free? And like, not unexpected, nobody really responded except for actually NBC Nightly News, who at the time had a reporter working for them called Robert Bazell. He was not a doctor, but he did all of their medical news coverage for NBC Nightly News. And so I went and interviewed, and they said, well, we've never had a doctor as an intern. We usually have college students, but why not? So here I was like over the moon that I had gotten this internship. And I had battle number two, which was convince my program director in Cornell fellowship in cardiology to let me leave fellowship one day a week and go to Rockefeller Center. And I thought, well, of course he's going to agree. I mean, this is so cool. And he did not agree and basically said to me, you know, what do you mean you're going to leave? You're in fellowship. I'm not going to let you go to Rockefeller Center. And he said no. And I was like crushed. And thankfully, I had a female program director who went to bat for me. And she went back to the chairman of my department and said, you know, I really think you should give Tara this opportunity. It's a really unique thing. And he ultimately said yes. So that was really a huge step for me, because when I went and spent time at Rockefeller Center, I would go one day a week for that last year. I really got to learn how people in the media report science and how they pick the experts that they use. You know, for example, they want people who speak, you know, clearly and succinctly. They don't want people who ramble on. How do they pick the stories that they cover? Why don't they cover, you know, this topic? Why this topic? And so I kind of got this background bird's eye view as to how the whole system works, which I never would have had if had I not done the internship. And so when I finished the internship, I finished my fellowship and I could no longer be an intern because I wasn't in training. I took a job at Lennox. That was my first job out of fellowship as a cardiologist. And once again, without really this path, I kind of went to the PR office here at Lennox and said, I'm interested in doing media. So if there's ever a need for somebody to comment on anything, you know, come my way. And that's what happened. And so, you know, it was, can you comment on this study for an internet article? Can you comment on this study for a magazine? Can you comment on the study for the news? And one thing led to another, and I did more and more. And ultimately, I did something for CNN's morning show, and I did something for the Today Show, and I did something for CBS. And pretty quickly, CBS called me. This was now in 2014. And essentially said, we don't want you to work for any other network. We just want you to work for us. And so I signed on to be a contributor for CBS News in 2014. And then slowly from there, over the last 7 years, have grown at CBS from being a contributor, really just kind of commenting on breaking news, to a correspondent, which means that I actually get to kind of pick the stories I want to tell and tell them you know, in a package, what we call package style format. So it's been this, I don't know if I spoke for too long, but it's been a really long winding road without a lot of clear cut pathways that I kind of had to create, but also really exciting. And every day I kind of pinch myself thinking, I can't believe the girl who was a first year med student said she wants to do this actually is getting to do this. It feels like a real like treat and kind of a coup that this happened. So that's the kind of story. And obviously this year with COVID has been, you know, insane, and that's a whole nother conversation. But
well, yeah, I think you know, like any good story, it actually it's not too long. It's actually just the right amount of time, and it opens it up to 1,000 questions that I'm sure are going to pour in. This is, you know, it's an interactive webinar, and we've got about 1,000 participants right now listening, and then, you know, we have 13,000 enrolled. The majority will listen offline on YouTube, and so anything you say here will be seen, and it's an important perspective, I think. So I think you know, my big question is, it's what's your life like now? So, you know, you're a correspondent, you have this commitment to something that you're clearly passionate about, but you're still a doctor and you still see patients, and that obviously gives you that moment when you go home and you tell your patient stories, and it motivates you. And so, you know, how often these days are you spending between both?
Yeah, I mean, it is a lot of juggling. I have to say, I mean, when I first started out, I was full time. So I was seeing patients 5 days a week. In fact, I was doing CCU. So I was like in the unit. It was
Yeah.
intense. And over the last 7 years, I've really transitioned out of inpatient, which again gave me more time. So I was doing outpatient medicine. I had a second child. And right around that time that I had my second child, who's now 5, the media stuff started picking up, and I basically went part time. So that's worked out really nicely. So now I see patients 2 days a week. This is my office here in Midtown, and those days are really packed. So Monday and Thursday, it's just like nonstop with patients, and then I have those other days to kind of obviously do patient follow up, which I'm doing today, but also work on stories. So for example, this morning I talked to my producer about a gun violence story that we're working on and when we're going to shoot that element. But to give you an example, yesterday was insane. I mean, I was up at 5 for a segment, a story that we did on CBS News yesterday morning. I came to the office. I had a full day of seeing patients. And while I was seeing patients, I got a call saying, can you come on today and talk about heat stroke? So I said, I'm happy to do that, but I can't even start thinking about preparing till tonight. Went home, got my kids in bed. By the time I sat down to work on today's story, it was 9:45 at night, and I was
Yeah.
up till midnight. So there are days where it's literally like I have to just, kind of compartmentalize and try to fit everything in. But more often than not, it's not that crazy. I do, try to keep those days where I'm not seeing patients to go and to travel for shoots that we might have if I have to leave New York, or to really do interviews if I have to do them. But it's really I love being a doctor. I mean, people have asked me like, would you ever give up seeing patients? And I always tell them, first of all, I mean, I that's like so much of who I am, and I love seeing my patients. But I do feel like to be good as a correspondent, as a journalist, you have to have that foot in the door, because I can't get up there and talk about, what people are feeling or seeing or saying if I'm not practicing, and every time I practice, I hear patients say why they're not getting vaccinated. We have that conversation, or, what their concerns are about drug safety and why they won't take their medication. So it just informs me in a way that I think you don't have that. You're not in touch if you're trying to talk about stuff and you're actually not seeing patients. And then vice versa, I think I'm able to come back to my office and tell patients, well, guess what? This is the concern with the Johnson & Johnson vaccine. And I can tell you that because I was just listening to the CDC call for my work, as a journalist, and I know all the
Yeah.
details of the problem. So it works both ways.
Yeah, absolutely. I think that's a great point. I think people are jumping immediately into the COVID experience, and so I think you have to give us a little bit of how this all happened and how you got through it. Obviously, you were doing this already. You were already a medical correspondent at the time when this happened, and then obviously the work stuff kind of screeched to a halt, right? As this became
Yeah.
focus number one. So can you talk us through a little bit about how it all went down, what the timeline was like, what COVID was like for you?
Yeah, I mean, that was insane, I have to say. I mean, I don't think any of us ever imagined that we would be covering or dealing with something like this. And so thank God the doctor part slowed down. And actually we couldn't come to the office because my husband, who's a surgeon as well, I mean, he was like, you're on your phone all the time. And I said, I can't put my phone down because every minute, I'm on the CBS email, there was a new study or a new thing, and nobody knew what was going on. And I felt, obviously as a medical correspondent, I already feel tremendous responsibility. That's just who I am. That's how I work, but to get things right. But now when there's something that everyone's scared of and nobody knows anything about, and you're learning about it, it was like just this constant drive to stay on top of every single thing that was coming out and to convey it in a way that would not provoke fear, but that was like clear and understandable. And so those first 2 months were like all encompassing. I mean, I was home with my kids trying to do Zoom calls with like the head of Pfizer to talk about stuff, and my kids are in the background. It was intense. And by the fall, it slowed down to a pace where we could kind of pick and choose the things we wanted to cover. Like, I'm interested in covering Longhaul Syndrome. Let's do a story on that. Or I'm interested in gender differences in responses to COVID. Why do men get sicker? But in the beginning, it was, just let's get out as much information in a clear way as possible. And and not to mention, like, living in New York City, as you know, I mean, we did not leave. We were here the whole time
Yeah.
watching everything unfold.
Well, I think the crazy thing, you mentioned responsibility, and that's, I think, the best word to it. It's based in what we do, right? We have a responsibility to patients. And so, every day you come to work and you have a responsibility to your patient to tell them what the best, evidence, the best practice is as we understand it based on the evidence, right? But now I'm talking to a variety of different people. I talk to savvy people, less savvy people, and I tailor what I'm saying based on what I think, someone's going to understand, or our conversation as it flows. You're conveying information to millions of people, right? So, how much time does it take to kind of parse something down to something that you can actually communicate well and effectively, and in addition to understanding what you're actually trying to convey yourself, right? Because it's twofold. It's number one, you have to understand it yourself in the scientific method, and then you have to take it to a level where the majority are gonna, understand it. What's that process like?
Yeah, I mean, I love it, obviously, but it is really complicated in the sense that you're right. It's number one, making sure that I understand it correctly. So to give an example again, because I think this sort of illustrates it, there was an Alzheimer's drug that just came on the market and a lot of controversy around it. And, meetings about it. There was also this issue with myocarditis and the vaccine, right? And so in order to talk about something that's really complicated, that it's even complicated for doctors to sometimes understand, like, I made sure that I was on the call, the ACIP meeting, for 5 hours, where everybody was talking about the research, so that I could come away from that saying, I listened to every single comment in that meeting. So if I have to talk about this, I've now heard everything that's been said, right? I've seen all the slides. So I do a lot of homework, probably more than like a lot of people. And that's not just on that, but, again, my husband sort of teases me, like, you prepare for a 3-minute chat, for hours. And it's true. I mean, I read everything I can get my hands on that's out there on the internet, everything I can research, because obviously I'm talking about topics that are not my field. But I feel that tremendous responsibility that I just cannot get it wrong, because people are making decisions about their life and their choices based on what I say incorrectly or correctly, or in a way, one way or another. So I think the first part is really about doing your homework. And I spend a lot of time doing research on my homework. In fact, a lot of times you'll see correspondents or contributors, they talk based on what their producer tells them. The producer writes up something and says, here you go, here's everything. I mean, I don't rely on anything from my producer. Like, I do all my own.
You can't, in a way, right? Because you're the expert. You're going to have a
Exactly.
different understanding. And like you said before, you have that conversation with your patients when you're in the office. You know what affects them or what doesn't affect them.
That's right. So I think
We got
the
a
first
few.
part, oh, sorry. I
No,
was
go
just,
ahead. Go ahead. Finish your thought.
yeah, I think aside from the homework, Randy, is just then figuring out how to condense it in that way where you have 3 minutes to say something, and they're telling you in your ear you have 3 minutes. How do I get the important nuggets across in a really clear way? And I think that's the second part that is sometimes challenging, because as doctors, we usually have time in the exam room to sit and explain in depth and answer questions. But when you're there and you have no time, it just adds like another level of difficulty to the whole situation.
Yeah, it's a rush without a doubt. There's a lot of great questions in the chat, and we'll keep peppering the kind of discussion with them. My favorite so far is, do you still own the juice bar? Which is a very funny
Well,
icebreaker there.
can I say one thing? I think what's so remarkable, and I am not like this at all, is how prescriptive you were about your decisions. Like, you knew, and like, you were patient, and you did it in a very methodical way. And I'm not like that at all. I'm much more kind of like ADD, like whatever the bright shiny object is, I'll go chase it for a while. That's not necessarily, there are benefits to both. I think the mechanical thing, you need to know when to change your course. I think another person that did this in media was Sanjay Gupta in our business.
Mm-hmm.
You know, he did it. He went to medical school, I think at Northwestern, and then went to Emory for residency because CNN was in Atlanta, and he wanted to go to, train where CNN was. And you did exactly the same thing with New York. So I think that it's emblematic of thinking this way. Can you comment on, well, I knew you, did you ever question that? Like, did you ever a point in time where you're like, is this going to really work out, or is this crazy? I mean, you came from Miami, all of a sudden you're in New York, and you want to be I mean, it couldn't have been like full steam ahead every single time. And did you ever have like second thoughts about maybe you did the right or wrong thing?
I never had second thoughts about the wrong thing. I think because I knew, like, if the media thing never worked out, I was so happy being a doctor. Like, that was such a solid thing for me, that I found my way out of business and into medicine, that I felt like I'm already doing something I love. And the other thing was just a dream. It was like a dream that, like you said, I just kept pursuing. And I think it's that kind of, as you said, it was the planning it out. It was never giving up hope. And it was also believing. I mean, I really believed. I would watch doctors on TV, and I remember saying to my family, like, I can't relate to them. I mean, I feel like they have no warmth. Like, to me, I want to listen to someone on TV that, like, I can connect with. And I knew that, like, that's why I love being a doctor, is that connecting with people. And if I just got the chance to, like, to be able to do what I do, like, there's a need for doctors on television who are human. And I felt like everyone I saw was like a robot, or I couldn't, like, relate to them. So I think it was like knowing I have something that's different, that's unique, believing in that, and just kind of keeping it in the back of my mind, thinking like, okay, someday maybe this will work out. Someday maybe this will work out. And if it doesn't, it's okay. I'm happy with my life, yeah.
So two kind of questions
along. I don't
along.
own the juice bar. I don't own it anymore. I sold it.
He sold the juice bar.
Yeah.
Two questions that kind of follow on that a little bit though. So, one student asked if you had any formal journalism education, or did this kind of come, based on, your study, you were just able to kind of translate it, what you knew into pursuing that? And then also, did your degree in economics help you in any way along this career path? Yeah.
I mean, it's kind of ridiculous that I majored in economics. I mean, I have no business sense. I'm not good in math. Like, I hate stuff like that. I don't even know how I got through a degree in economics. But the first question, what was the first question?
Regarding journalism, did you have any formal journalism?
No, I had no formal training. I mean, I always liked to write. Like, I remember in high school, actually, I wrote an essay about watching a heart transplant. And I wrote it for, like, a college application. And my mom, unbeknownst to me, like, turned it into a magazine. Like, there was a magazine having a competition to win a prize. And it was for doctors. And she sent my essay in, and I was like 16 years old. And I won, like, a cruise. I won, like, the first prize for the essay I wrote. And so my parents were always like, you should write. You should really be a writer. And so I knew I had that, like, love of conveying a story, and I loved people's stories. And so I think I just felt like, again, like, I think I can do this. But no, I had no formal English background, no journalism training. And then a lot of it's just, like I said, learning on the fly, like how they write the pieces they write and how they tell the stories based on the internship I did and all these years now at CBS.
Great. Some people are asking about the Longhaul Syndrome, if you want to shed any light. We actually had a discussion in the last conversation too with Dr. Rosen about some of the misunderstandings with the mRNA vaccines and cardiovascular disease, but specifically the Longhaul Syndrome.
Yeah, I mean, I think one of the most interesting stories that we just did was there's an immunologist at Yale who noticed on social media that there were reports about people getting better after they got their vaccine. And she started to look into this. And she, so I interviewed her and asked her, how is it possible that getting vaccinated might improve Longhaul Syndrome? And she basically said, it's possible in the sense that there may be remnants of the vaccine, right, hiding somewhere in the body undetected, that when you get vaccinated, it sort of gives you that extra boost to clear out those remnants. It may be that there's fragments of the virus and you're sort of clearing that out. So I think the idea that long hauler is somehow, this syndrome where certain people just don't efficiently clear the virus, and that something is left there, that getting that extra boost of immunity from vaccination might help is fascinating. And, there's no doubt it's a real phenomenon, and I think the sad part about it is that so many people think I'm young and healthy, I can get COVID and I'll be fine. And what I always tell them is, you might survive, but like, do you really want to be debilitated in your 30s or 40s and unable to work or walk or exercise? And we've met so many people who their whole life has been turned upside down because they've become a long hauler. And it's sad. It's sad. I mean, hopefully one day we'll have a better understanding about it. But I think right now every day we're learning more about it.
Yeah, it's interesting because it doesn't always have to be as devastating as that also, but still negatively affects people, right? I mean, for instance, just anecdotally, my mother still cannot smell or taste. And
Yeah.
when she does smell, she has this phantom smell of gasoline. And she functions, she lives her life every single day. But when it's dinner time, or God forbid, someone wears cologne next to her, it torments her. It's just torment, right? And I think it's very, very interesting how she had COVID a year ago, she did fine, she survived, it was never that sick. And so, there's the people who are really devastated by it, by the real, constant joint aches and, everything else that's going on with it. And then there are these people who are just subtly influenced every day by it. As neurosurgeons, we have a lot of patients who live without the sense of smell, right? Certain tumors arise there, and we think that that's fine. They're alive, they're doing fine. And maybe from a neurosurgical standpoint it is, but it really actually does affect people in the long haul.
I mean, I had COVID and my husband had COVID and I lost my sense of smell. And I can tell you it was terrible. It's like, you forget how important it is. And I think it took actually just recently, last weekend, I said to my husband, I think I'm finally getting my sense of smell back. And this was in December when we were sick. So
that's a long time. Yeah.
Yeah.
I had lost mine for about 4 or 5 days, but my wife was about 2 weeks. I think we always get a lot of questions about work-life balance. We covered it before. Your days are hectic, right? Your week, I'm sure, is packed. How do you do it? How do you take this job, your medical job, your family? How do you balance that on a day-to-day basis? And how do you keep yourself sane throughout all of it?
It's such a good question. And I think it's definitely one that in particular, a lot of women wonder about, how am I going to have kids and do all of this? And I certainly thought the same thing. I mean, when I got pregnant with my first child, I remember thinking, how am I going to be a doctor and do the TV and have a child? I have no idea what I'm doing. And, you just do it, right? You just make it work. And then when it was time we had our second child, I thought, now I'm really going to sink because now I have 2 kids. But you just fit it in. I think I think it's like everything else, like it becomes part of your life. I mean, thank God I have a good nanny now. We've been through, we have good help, and that makes a world of difference. And I have an amazing husband who, helps and we work together as a team. And so I think, that support is important, but, it's not easy. I mean, there are, mornings where like I'm not seeing my kids, like this morning, and because I have to go in early, or I get home late and they want my attention and I'm exhausted, so there are a lot of times where I feel like a failure as a mom, but, I think in the long run, hopefully they learn that I have 2 girls, that you can do all of these things if you want, and kind of balance them out. And I think as far as staying sane, I exercise. Like, to me, like my time when I go running or I go to the gym is like my time to just listen to music and decompress. And thanks to Dr. Bukvar, who introduced me to Calm, I started using the Calm app to meditate last year. And then I made my husband use it and my kids use it. So now we all try to meditate. So that helps. And then just honestly, my family time is my downtime. I love being with them, and that just makes me happy. So, yeah.
Happiness makes everything else easier, right? So,
yes.
Let me see real quick. We'll jump into some other questions.
I have a quick question. How is your when did you finish your residency? What year were you done your residency?
2007.
So how's your kind of strategy with media change? Obviously, social has become such a big part of mainstream. I'm sure the media environment you thought you were entering when you first made the decision and what it is now is completely 2 totally separate things.
Yeah.
And local news, as compared to what it was when we were growing up as a fraction of the audience that it was. There's just so much. So how do you, as a medical person who wants to influence public awareness and information, and you want to have a role in the, how have you modified what you do? I know you're really active on social, but what types of things do you have to do? And even for this audience, what can they do to do the same thing?
Yeah, I mean, like none of us, like I didn't have a cell phone, obviously, until college. I mean, it's a whole new world now than it was when we grew up. And I actually wasn't even on Twitter until once again, John Bukvar saw me in the hallway at the hospital. I was like, what do you mean you're not on Twitter? You're in the news. You have to be on Twitter. So he's the one that sort of got me on Twitter. But obviously with what I do, that is a big part of it, right? So I can do a story on TV, but if nobody's watching in the 8 a.m. hour on CBS, they're going to miss it. So having the ability to put your work out on social media, it allows it to get seen by a much broader audience. And so it is part of our world. And I think everyone has to get used to that in a good way. I mean, in the field of cardiology, I will say, I don't know about other fields, but the cardiologists have really adopted social media like in a huge way, in terms of they will use Twitter to talk about studies and what they think about studies. And our medical meetings are, tweeted about, live tweeted. So I think, not only is it being utilized in news and media, but just as like medical professionals, more and more we're using that forum to educate and to teach and to connect people from all over the world. So I try to use it as much as I can. It takes a lot of time. It's actually like a lot of time to like get on social media and post all these things. And the downside is it obviously opens up the door to people who are not so friendly and kind and who are very critical and will find anything you say wrong. And obviously you have to have a little bit of a thick skin. Again, I remember my husband saying, and when I started out doing media, and saying something, and then I think it was about the HPV vaccine, and I got all this like feedback from people talking about how I was killing people, talking about the HPV vaccine. And I remember my husband said to me, like, Tara, like, you have to understand, you could say the sky is blue and somebody out there is going to say like the sky is not blue. No matter what you say, there is a world of people who are going to find something wrong with what you've said. And I think once I accepted that I didn't have to, that there were always going to be critics and people who say negative things, it made using social media a lot easier, because then you just feel like, all right, I'm just not even going to respond. I'm going to put whatever out there. You guys say what you want. But it is tough, I think, particularly for younger people who are on social media, to deal with that aspect of social media.
Well, it's also, you put so much into it, right? You put so much hard work into what you're presenting. You're trying to maintain an objective presentation. Medicine's a little different than some other types of reporting. You're trying to be honest with people.
Right.
And when that honesty is misconstrued,
as opposed to the rest of the media where they're trying to be dishonest with people.
Right. Yeah.
Well, I don't know. It's just, I think, more so than maybe some other stories, this is supposed to be unbiased help for people. And so I think it hurts your feelings when someone's negative towards you.
It does.
And and you feel like you should respond, but engagement is just never engage. That's
I don't engage at all. But yeah, I agree. I think that's the thing. I mean, not only is it as medical professionals, like we try so hard to do the right thing, but like, I mean, that's just who I am as a human being. And I work so hard to get it right that when you put something out there and then somebody says, oh, what pharmaceutical company is paying you to say this? And I'm thinking, yeah, of course I'm not getting paid by a pharmaceutical company. It's just so ridiculous. It's like you have the best intentions and people think you're out trying to harm them. And that's tough. That's tough.
Yeah. And Tara, I mean, it's great talk, great insight, I think, for everyone listening. One of the things that I think we have to touch on, especially just given, the conversation we had with Dr. Rosen and some of the stuff I prefaced this whole conversation with, is just your experience in medicine as a woman and also in media as a woman. All right. And can you talk a little bit to that? Have there been times where you felt you were treated differently because of this, or have you felt that it's empowered you in a way that maybe people don't often consider and helped you with your success?
Such a good question. Yes to the media question, sadly, but I do believe that in that world, I have seen men get treated differently from women. I have experienced that. I don't like saying that, but it's a reality. And you have to fight hard and put your foot down. And I think again, for me, like I'm not somebody who, and maybe this is true for a lot of women. I think we think if we say something, it's going to be construed the wrong way. And so we tend to kind of stand back. And a part of what I've had to learn is that just because you speak up and advocate for yourself, that's actually a good thing. And that's actually how you're going to get the things that you want. It's not by sitting back and saying, oh, but maybe, could I, you have to be straightforward and you have to ask for what you want. So as far as the medical world, I think I'm unusual because I do hear from a lot of my female colleagues about dealing with situations like that in medicine. And I hadn't experienced it. I really haven't. I felt like I was sort of treated fairly at every stage of my training. I didn't encounter that, but I think my experience is maybe a little bit different. And again, I don't know if that's because of my personality. Like I tend to be a little more vocal and stronger, and maybe that helped. But I mean, it's a reality. I hear it all the time from my female colleagues in medicine. Like I said, I've seen it in the media world. And my one advice would be, just say something, speak up. You have to have a voice, and you have to go after and ask for what you want. And I think that's particularly true when it comes to, for example, salary negotiations and discussions, which again, we have in medicine and in business, but you're not going to get what you want if you don't push for it, ask for it.
Which is more male, I think media seems even worse than healthcare. I mean, there's obviously a lot of it's in the media, the stories about, what's going on at NBC and CBS in particular. And it seems really, really pretty bad at the very top of these organizations, as opposed to medicine, which seems like there are a lot more women leaders. It's not equivocal to what it probably deserves to be, but media sounds pretty rough still.
Yeah, I agree. I mean, I think probably if I had to weigh them, it's probably worse. But it is, I mean, we know in academic medicine too, I mean, the number of women that become professors, I mean, it's a struggle just to, just to achieve. I mean, there's an example, by the way, of, my journey being different, right? There's no category for professorship, associate professorship for somebody who does medical journalism, right? So how do you carve out, how do you get people to understand that there's value even in an academic setting? It's a fight, right? It's something you have to kind of push for. But you see it in all worlds.
Yeah.
I'm scrolling through the chat here. There's a ton of great questions. I'm trying to find stuff we haven't really covered. I mean, you've been so great. We've covered pretty much everything. I think, some of the stuff that is people mention about is actually finding, how to combat bias in the media. And, we touched on it a little bit. And there are obviously these things exist. And kind of we said that, medicine hopefully strives to be the most honest of all these presentations, because you're dealing with public health. You can't afford to be wrong here. What do you think? Do you have any advice for people watching, or for when people, hear a report, what to consider and how to kind of take it all in?
I mean, if I'm answering with I'm a person sitting at home watching the news voice and not somebody who's in the media, I think bias is a real thing. I mean, I think it does exist. People are human. The people putting news out there are human beings, and they are going to sometimes pick and choose and tell and write it in their voice, in what's important to them. So I don't think you can completely eliminate it, unfortunately. I do think that in medical journalism, I do think it's a little bit different, right? Because there shouldn't be a bias. I mean, we're just trying to tell the facts of whatever the science is, and it usually is a factual situation. I mean, it is these are the pros of the vaccine, these are the cons. This is what the research study shows. This is, so we try to report it as fairly as possible. Now, that being said, again, to kind of draw on the Alzheimer's drug as an example, there were people on both sides. There were neurologists that we interviewed saying, this is great that we have a new drug to treat Alzheimer's. And then we had other people saying, this is ridiculous. This never should have been approved. So, how do I tell that story fairly, right? When I have people on both sides saying something. So there is a little bit of trying to navigate when things are not always clear, how to put something out there so people can make their own decision, but yet hear both sides, right?
Yeah, I think and someone else alluded to this in the chat too. I think that's kind of a really important thing to understand is how you take your personal bias out of things too, right? You're a physician, you've studied this, you can read between the lines, you can look at the literature, and you know, maybe to a degree, or at least have a hunch that something doesn't make sense or something's not right. And yet you have to present both sides, right? And so how do you kind of talk yourself into kind of, where do you put yourself in that conversation?
Well, I try not to insert myself, right? I mean, I think in the beginning when I was more of a medical contributor, right? A lot of times you'll see even now, especially with COVID, there's so many more doctors who are doing television. And they will talk about their opinions, right? So they will say like, I think this is right or wrong, and that's their opinion. That's what they're paid to do, or that's why they're chosen to be a contributor. It's a little bit different for me now because I'm not supposed to give my opinion, right? That would be wrong. So, but yet I'm supposed to wear my Dr. lens. So it is a little bit tricky, but I try to take myself out of it as much as possible and let the science sort of speak for itself, which is not always easy to do. For example, with the vaccination stories we've done, vaccine hesitancy, right? I mean, there are people that feel strongly against it. I could tell the story and say, vaccine hesitancy is real, and this is why we should support vaccine hesitancy. And look at all these people who said they had a problem getting it. I mean, the way you tell the story could really shift how people see it. But we told the story by interviewing people who are vaccine hesitant, so you could hear why, but yet hearing the scientists say, these are the myths we need to break down, and this is where we've gone wrong, and this is what the science is. So I think it's letting the people speak, but crafting it in a way that's like as true as possible without my voice being in there. But it is hard sometimes. Sometimes I do have strong opinions about things and I can't always say them.
So, you've made very, very specific moves throughout your career. Where are you going next? What are the next steps?
The goal now, you can meet me in 10 years on Zoom and we'll see if I've actually charted it out the right way. But ultimately, I would like to have my own show, like a 60-minute style show where we can just talk about medical stories, but in a very human, emotional, real way. So that that's my dream, and that's something that I've pitched to the network, and that's the goal, is to have a platform where I can tell other people's stories in longer than 3 minutes on the morning news or 2 minutes on the evening news, which is just not enough time.
Yeah, it's complicated, but I like it. So Brain Turns 10.0 will revisit you.
Yes. Yes.
Anyway, listen, it's 11:50. We got a couple more minutes if anyone wants to add in any last minute questions. I really appreciate your time. I know that we're squeezing in here in the middle of a busy practice, a family, and the news, which never stops. And so it's been a real pleasure. And like I said, this will go on to our YouTube channel, so students who weren't involved now can watch it in a delayed fashion. And yeah, I appreciate it.
Thank you.
A lot of them are asking the best way to contact you, Tara. I don't want to open up a can of worms. You're usually relatively respectful, but if you choose to give them some advice about how they might contact you, that would be appreciated by them. How you want to do that's up to you.
Let me think about that, and I will get back.
Not everyone does. Yeah.
I was gonna put your cell up there. Is that okay?
Well, I have 3 phones, so I have a CBS phone, a Northwell phone, and my own phone. So.
And you need a Brain Turn phone.
And now, now I need a Brain Turn phone.
You might need a Brain Turn phone. Yeah, think about it. Take your time.
I will. No, I mean, it's really important. I think what you guys are doing is so amazing, and people need to see that there are different things that they can do and that they can follow their dreams. And I think it's so awesome. And to start hearing about this when you're in high school or in college or in medical school, I mean, that's the right time to get those seeds planted. So.
Yeah, I think, the real value also is medicine's heterogeneous. It's not the same cookie cutter recipe to how you become a doctor, and everyone's got a different story, and everyone is represents a different person and a different cog in this machine. It's a big complex machine. And so we highlight the nurses, we highlight the physician's assistants, we highlight the administrators, and then, you obviously see the traditional route as well. And we see that, anyone from any background can create their journey through this in their own way. And so I think that's where the real power of this has come. And it's been a pleasure. So
nice to see
all right.
you guys.
Anyway, have a great day. Thanks, everyone. See you Monday.
Have a great weekend. Have a great weekend, everyone.
Bye.
Thanks, Randy. Thanks, Ashley. Thanks again, Tara.
Thank
Thank you so much, Narula. Appreciate it.
Bye.